Hello everybody, my name is Matthew Mitchell, and today my speech is on the importance of mental health services. Imagine not being able to get the help you need. The importance of mental health treatment has often been overlooked by society. However, society needs to understand that this is an important issue that cannot be overlooked. Mental health needs to be a priority in society, and plenty of research helps to advocate that mental health needs attention. There's one question I want to ask you guys before I begin my speech. And that is, do you think that having access to mental health services can help to improve the overall quality of someone's life? This research and data collected answers the question, and the research concludes that yes, it does help improve the overall quality of someone's life. The information I gathered is retrieved from both educational and governmental sources. Through carefully choosing these sources, I can let you know that the information that I am sharing with you is credible enough to rely upon. Also, my personal experiences while providing care to individuals with special needs has allowed me to experience firsthand the benefits of mental health services. After presenting this information, all of you, I am sure, will develop a stronger understanding and for the truth behind the effectiveness when someone receives the mental health services that they need. Studies have shown that when mental health services are available, those affected by a mental health condition will be better served. Early intervention is very important. In a study done in 2005, there was an early screening program that concluded that approximately 18,000 young participants throughout 42 states in our country had a mental health condition. Now, of these 18,000, approximately half of them, 9,000 minors, were referred for further evaluation. If this initial screening program didn't take place, there would be 9,000 minors in our country that would be living their life with a mental health condition that goes unrecognized. During the year 2005, nearly 17% of high school students nationwide, 17%, had considered suicide. And 8.4% of high school students had previously attempted suicide the year prior. This information was gathered from an educational source, opposing viewpoints and contexts that I retrieved from our Three Rivers Library database. The author is Richard Freeman, who performed plenty of research, and he is a professor of clinical psychology and a director of psychopharmacology clinic at Weill Cornell Medical College. His credentials, I believe, allow us all to understand that this information can be trusted. Studies show that identifying mental health conditions early can help to minimize the long-term effects of mental health disorders. If a condition goes unnoticed, there will be negative stigmas involved with this category of mental health issues. One teenager says that without screening, I'm not sure how I would have gotten the help I needed. Young people become vulnerable to several emotional, social, and academic impairments when their conditions go unnoticed. Also, when these conditions go unnoticed and untreated for a long period of time, there are extreme consequences for every individual, and suicide can become a consequence of significant concern to our society. Now, what's at stake when a mental health condition goes unrecognized? Well, according to the National Alliance of Mental Illness, the estimated costs are a lot more when a condition goes untreated and unrecognized. According to a study in mental illness is prevalent in America in 2012, a writer, Marla Central, who has done much research in regards to mental health issues and the treatments that are provided, she learned that the cost of untreated mental illness is $100 billion a year in the US when a mental illness goes untreated. Awareness is important. Our country is lacking its ability to reach out to the mental ill population. There's a lack of evidence and practices. Also, there are no mental health courts in our country. Lastly, there is a deficiency in law enforcement training when it comes to individuals with mental health issues. Now, law enforcement is provided education and training in regards to how to approach individuals who have a mental health issue. However, there needs to be more attention towards it. And that's why this issue of mental health has been overlooked by society in past years. Now, mental health services are essential, as they do, according to this research, help to improve the overall quality of life in an individual suffering. According to a source on the Harvard Hospital website, more people die from suicide than from cancer, heart disease, AIDS, birth defects, strokes, pneumonia, influenza, and chronic lung disease combined. Now, when I first came across this fact, I find it hard to believe because these are all serious conditions in our country that people died from. And then, seeing as though it was coming from the Harvard Hospital website, I am able to value this information and believe in it. And the fact that suicide can cause more deaths than all these conditions combined lets you know that this is a serious issue, and it can't be overlooked. When someone receives the treatments they need, much of this disaster can be prevented. The National Institute of Living has funded a study recently. According to this study performed, approximately 65% of boys and 75% of girls that are locked up in a juvenile detention center have been reported to have at least one mental health condition. Now, what many people have to do and our society has to learn is that we need to advocate for our loved ones and for those who are going unnoticed. Society is not aware of the importance that mental health services can bring into someone's life. And they need to be educated so that they can develop a stronger understanding for what these people go through and how it affects us every day of our lives. According to a recent report, deep cuts have been made in which have reduced spending on services for children and adults with mental health issues. This reduction in funds has led to a reduction in services offered by a variety of hospitals and even community programs. This is according to the State Mental Health Cuts, the Continuing Crisis webpage. It was updated in the year 2011 in the month of November by Ron Hanberg. Families can seek help at a variety of agencies and hospitals, and even at their own job when they are educated on these issues. There are many programs to provide assistance. This is according to the Treatment of Children with Mental Illnesses in 2009, which is a website sponsored by the U.S. Department of Health and Human Services. This lets all of you, the audience, know that this information is valid and can be trusted. According to this research, I am sure that all of you will be able to learn and further look into why mental health services are important and why they need to become a priority in our society. If a mental illness goes unrecognized, a person may suffer and face many troubles in life. The data that has been gathered and presented has been carefully analyzed and peer-reviewed before publication, like I've mentioned. The research performed indicates, once again, that mental health services cannot be overlooked, and they need to be a priority. These sources conclude that having access to mental health services, when needed, can help to improve the overall quality of someone's life. If we help individuals find help, we can help them find hope. Thank you.